Today we're talking about the interactive voice response or IVR system. This webinar is part of a series. If you want to catch up on past sessions, you can find them on our YouTube channel and the Encore presentations page of our website. We have a few more to do, so if you're interested, watch for future sessions. So why did we choose this topic? We created this education based on survey responses from our provider community. We review those surveys daily. We take those responses very seriously as a way to improve our customers' knowledge and your overall experience. I invite you to visit the training center area of our website. This is where we post the event materials for webinars about a week in advance. So if you want to download a copy of the slide deck, you can find it on our live events page. This is also where you can find out about and register for upcoming educational events. The recording of this and other live webinars will be on our website as an Encore presentation for anyone who missed the event or wants to listen to it again. Depending on the number of events, they will normally be available for 60 to 90 days. You can also find them on our YouTube channel. Today, you're going to use the chat feature to add any questions that you have related to today's topic. And then at the end of our prepared remarks, we'll take as many questions as time allows. Whether you're listening live or to the Encore, we hope that you'll take the opportunity to give us your feedback by taking the survey. Those surveys give us insight into how we're doing and the types of education that you want and need. This slide is our disclaimer message. And, among other things, it does let you know that the information we're providing is accurate and complete to the best of our knowledge. But as a government program, Medicare does change sometimes. So you always want to go back to the federal regulations because they're going to take priority over anything that's presented today. The next few slides contain acronyms. Acronyms that were used in the creation of this presentation or that I know specifically I'm going to mention in my speaking points. Medicare is full of acronyms, so we want to define them for you, but then we also want to give you a reference so that you can look back and just refresh yourself with what that acronym means, because everything has an acronym almost in the Medicare world. So what are we going to cover in this session? First, we're going to start out by defining what the WPS IVR is and what it can do, real briefly. We're going to examine what information you need to have ready in order to use it. That will speed things up for you and make it a more smoother interaction. We'll share tips along the way for using the IVR to obtain, claim status, and then we'll conclude with exploring where we can find more information. Medicare is all about where you can go to get more information on the topic that you're interested in or to find the information that you need. So resources are very important. So as the name states, the IVR is a voice-activated system, but users can also use their touch-tone telephone keypad to interact with it. So that's important to know. What kind of information does it provide? Well, among other things, the things you see listed here: claim status, payment information, overpayments, remittance advice, and overlapping claims. Depending on whether you're a Part A provider that bills on a UBO 4 or 837I electronic equivalent, or you submit Part B professional claims on the CMS 1500 or 837P. The items you can access in the IVR are different because of how you bill and what you bill for. So you'll see some of those differences in a few minutes as we go along here. If you're requesting information other than of a general question, the IVR does require you to authenticate your identity before being able to access claim, beneficiary, or provider-specific details. And this is to protect you and the integrity of the information that the IVR gives out. You'll be required to provide certain data before you can go any further. This slide here outlines those required elements as they relate to a provider. And so we start with a valid NPI, National Provider Identifier, and PTAN, Provider Transaction Access Number. The tax identification number also is part of that combination to authenticate that you are who you say you are. You're only required to enter or say the last 5 digits of your tax identification number, but you do have to say or enter the entire PTAN and NPI. The last item here is the remittance advice. You should also plan to have one of those handy in certain instances if you need to be transferred to a customer service representative, because they may ask you for information from that remittance advice. Again, all in an effort to authenticate that you are who you say you are and that you are entitled to the information that you're requesting. On this slide, we have some beneficiary elements. So these are required in some situations with some inquiries. The beneficiary's name as it appears on their Medicare card. And I made a note here because this might not be the name that you know the patient as. You know, some of you might be in rural hospitals or have patients that you see on an ongoing basis. And so, you know, you may know someone as Milton, but their given name is just Milt. Same with Danny or Daniel or Timothy and Tim, things like that. So we need the name as it's written on their Medicare card, not those nicknames. Because if it doesn't match what Social Security has, which is where they sign up for Medicare through, you're either going to get wrong information or it may not be able to find that information for you at all. If you're using the keypad to enter the name, so if you're using your phone, you'll have to enter the numerical equivalents for the first 6 letters of the patient's last name and their first initial of their first name. We also need the patient's Medicare number, known as the MBI, Medicare Beneficiary Identifier. And this, again, is from their red, white, and blue Medicare card. It's not their Social Security number, their Medicare Advantage ID, their subscriber number, member number, or any other kind of medical record number that you might use to identify the patient. It has to be their MBI from their Medicare number. Depending on what you're looking for, the system requires the patient's date of birth and the date of service if your inquiry is required for those 2 things. If your inquiry requires those 2 things. Other items that you'll need. We suggest you use a telephone with a handset or a headset. And the reason for that is because they'll pick up your voice better and hopefully not capture any unintentional background noise. So because of that, we don't recommend speakerphones and cell phones. Equipment is different. Yours may work perfectly well, and that's okay. But for people who are just getting started with the IVR, we make these recommendations just to try to give you the most successful experience possible. You'll also want to try to be in a quiet environment. That way you can speak in a natural, clear tone. If there's background noise, let's say you work in a business office or a reception area where there's unintentional and unexpected background noise, then it won't be as likely to confuse the system. Consider having the IVR operating guide handy, open on your computer so that you can refer to it if you need to. That guide gives you step-by-step instructions on how to enter information and navigate the menus. Make sure that you have the correct one, and I mean A versus B. The prompts will not get you to the right place if you're not in the right one. It's not difficult to find the guide, but I do suggest bookmarking it so you can get back to it as needed. And the same goes for the IVR conversion tool that we have. And I'll show you those things in just a few minutes. Have that page bookmarked as well. This is going to help the system assist you in converting alphabetic data into numeric format if you're entering it in by way of your touch-tone telephone. We also have a chart or a cheat sheet that you can have available if that works better for you. That's another option. Again, we're going to look at those items in just a few minutes. So when you first dial in, the IVR gives some preliminary messages. So this could be special announcements, information about system outages or current issues, things like when the next customer service training closure is scheduled for. It has instructions for accessing the survey at the end of your call so that you can give us feedback about your IVR experience. And the opening messages can change as needed depending on the situation or direction from CMS. After these messages, the system's going to give you the initial prompt saying, in a few words, please tell me why you're calling. For best results, your responses should be short, but provide enough information to route your call correctly. An example would be, I'm calling about a claim denial, or I want to check overlapping claims. In keeping with today's topic, you could say, I want to check the status of a claim. Or you could say claim status or claim information, any of those things. Some IVRs use a phonetic alphabet where you would say Apple or Alpha rather than A. The WPS IVR uses what we call natural language understanding. Natural language allows for a more conversational encounter, if you will. So this way, you're not limited to predefined terms or touch tone options. Instead, you can speak freely to express your needs and intentions. So kind of like if you were actually talking with a person. The goal of natural language processing is to improve the customer experience, reduce the number of prompts that you need to listen to, and route you to the right resource more quickly. So at this point, after that preliminary message and you've told the system what you're looking for, at this point it's going to ask you to speak or enter your NPI, PTAN, and the last 5 digits of your tax ID. If you'll be entering them in with your telephone keypad, this is where those conversion tools or charts will come in handy. After you've authenticated with those items, the system will then begin to ask you for the patient's information. For those of you that have participated in previous IVR sessions, I know that this is a review for you, but we do have some people on the line who are attending for the very first time. or if they're listening to the encores, they may not listen to them in the same order. So we want to be sure that everybody gets this information. Some of your patients may have a prefix or a suffix in their name. This requires some knowledge of what the IVR expects so that the correct information is obtained. We're going to start with suffixes. So for suffix abbreviations such as junior or senior, if you're speaking the name, say junior or senior. If you're keying the name, if the last name is less than 6 characters, because remember, you only have to enter the first 6 characters of the patient's last name. If it's less than 6, you'll key in the JR or SR for junior or senior. If the last name is more than 6 characters, you'll not need to key in the junior or the senior. For suffix numbers such as the first or the second or the third, when keying the name, don't say second or third. But if you're keying the name, again, if the name is less than 6 characters, key the letter I, which is the number 4 on your keypad. When keying the name, if the name is more than 6 characters, then again, you're not going to need to key the suffix second or third. If your patient has a prefix, such as sister or father, when you're speaking the name, say, just for example, Sister Mary Jones or Father Patrick O'Leary. When keying the name, key the letter as if the first letter of their first name. So for our example of Sister Mary Jones, it would be keyed as the numerical equivalent of Jones and then S. S for sister as the first digit or character of her first name. I hope that makes sense. Some additional tips for patients' names and numbers here. Entering the patient name in the keypad is different than entering Medicare numbers, and that'll be clear when we look at the conversion tools. So again, the patient's name using the keypad is different than the Medicare number, your NPI, your PTAN, and your tax ID. That conversion tool, that chart's really going to come in handy, and it's going to save you from going in circles in the use of the IVR if any of those things gets keyed incorrectly. The conversion tool, I've mentioned that a couple times, and it's located in our IVR operating guide, and it's in the entering data section. It's going to assist you in converting that alphabetic data into a numeric format for entering using your touch-tone keypad. I also advise you to speak long numbers in sequences of 3. So if we use the example that we have here, you would want to say this as 543, 789, 147. So the system, the guide recommends you speak it in sequences of 3 with a very brief pause in between there. Avoid grouping the numbers together. And I know I'm guilty of this when I speak, so it's just something to keep in mind. Avoid grouping the numbers together. So with the same example, we wouldn't want to say it as 54, 37, 89, 14, 7. The system will have a harder time identifying the actual number that you want it to input. The system's just going to work better that way. So we just wanted to pass along some of these best practices for those of you that are, maybe just learning about Medicare, or you're just learning about the process of checking eligibility, or you're new to using the IVR altogether. So just some tips that we learned from using the system ourselves. Part A and Part B are slightly different for some functions within the IVR. So I did separate them to try to help make it more clear. So we're going to start with Part A. I also need to explain that in our ongoing effort to improve and make sure you have the best experience possible, the Part A IVR has been updated recently within the last couple months. And so one change is that Part A providers are going to press 2 or say claim information. And then after that, then you choose the secondary option of saying claim status or press 1. At this point, you'll say or enter the patient's MBI, first and last name, using the hints that we just talked about, their date of birth, and their date of service. The system will begin to reply with status details, such as the things that you see here. Not necessarily in this order, but these things, the number of claims for that date of service or that date range. The receipt date of the claim, the type of bill that it was sent in on, total charges on the claim location, and the status of the claim. And the status of the claim can be any of these that you see here. Again, this is for Part A claims. Some of the claims details that the IVR may provide are listed here, depending on if they pertain to your claim. So the date the claim was processed, whether the claim paid as Medicare primary or secondary, the provider reimbursement, any inpatient deductible or coinsurance that was applied, beneficiary liability, if there are non-covered charges, and the check number. The check number could also be the EFT if it was paid electronically, and I can tell you that most of our providers are paid by electronic funds transfer. So don't let that check number throw you. It could also be the EFT payment. This slide has some additional claim detail data for our Part A providers. Excuse me. We have additional documentation requests, dates, so the date that an ADR was sent out if the claim would happen to be in the process of being reviewed, the document control number that was assigned to the claim, the FIS reason code and description. This is the Part A claims processing system. So if the claim has a reason code, it will be listed there along with a brief description. If the claim is offline, you'll hear the message that the claim is currently offline. The system is retrieving the claim for you, and then you can check on it in 7 days. There's a whole process for retrieving claims that are offline. If you're a Part A provider and you use direct data entry, that's in the direct data entry manual. After you receive claim information, then you have other requests that you can make. You can say operator if you need assistance from an agent. You could say repeat that, claim detail, next claim, previous claim, additional PTAN information if more claims are available. Change date to change the dates of service if you want to check a different date or a different range. Change Medicare number, change the PTAN, or change the NPI. And then if you want to start over again, you can say main menu. Now let's switch places and talk about those of you that bill on the CMS 1500. What kind of status information can you get from the IVR? Of course, this is going to be after you authenticate, after you enter the patient information. So for an assigned claim, you can get the items listed on this slide. The date we received the claim, the number of claims for the date of service, the status of the claim. So what that means is, was it denied, paid, or is it pending? It'll also give you the amount submitted and the allowed amount. The IVR will also respond with the amount applied to the deductible, if anything, the amount paid, the paid date, the check number, and crossover information if it would happen to apply to your claim. It'll also give you the date and the amount the original claim paid on adjusted claims. So all of these things might not pertain to your particular situation, but these are the types of information that Part B assigned claims can get from the IVR. For Part B assigned claims, there is detailed information available. And this would be things such as the claim control number, the number of line items, and the specific line item information shown here. So this would be things like the date of service, the procedure code, any modifiers, the amount submitted, the allowed amount, and the reason for the denial if the claim was denied. For those denied claims, you will hear the ANSI, which stands for American National Standards Institute, the ANSI reason and remark codes, patient liability, and additional information regarding the denial if it happens to be available. This might include things like items to check and steps to take to correct your claim, if that were to be necessary. All those things that we just covered were for assigned claims, but how about those non-assigned ones? The information is more limited in that situation, but no less important. You can receive the number of claims for the date of service, the status of the claim, which again will be denied, finalized, or pending, and if it applies to your claim, any crossover information. Just like with Part A claims, after you receive Part B claim status information, you have other requests that you can make. You can say, operator, repeat that, next claim, or previous claim. You can say duplicate remittance, but that's only available for assigned claims. Additional PTAN information if more claims are available. Change date to change the date of service you're looking for. Change Medicare number, change the PTAN, or change the NPI. If you want to start over, you can again say main menu, or if you're finished with the IVR, you can say goodbye. You can use those two things anytime. So what other pointers can we give you here when you're using the IVR? First, know that you don't have to wait for the entire prompt to play. You can go ahead and key or speak your selection if you know what it is. If the IVR says you can say additional information, it probably means that there is more data associated with your request. So use that as a clue. If the IVR is having trouble recognizing what you say, we all have instances where we have a sore throat or we've got a head cold, things like that, or there's unexpected background noise. If the IVR is having trouble recognizing what you say, enter the information using your keypad instead. You're not going to hear the touch tone options during the initial prompts. So that means that when you first get started in the IVR, even though it doesn't say you can press 1 or press 2 for a certain thing, know that you can do that. And again, this is all outlined in the user guide. So now I'd like to actually show you how to find some of the things that I mentioned. So first we're going to go out to the WPS website, and I have it hyperlinked here, so hopefully this will work for us. Just takes a minute to open that up. Okay, so here we are. And it looks like I'm already in J5 Part A. I must have been out here already today, so just for the sake of ease, we'll stay there. So the first thing that I want you to notice is over here in our quick links on the right, we do have a quick link to the IVR conversion tool right here. So we could actually just jump right to it from there, but I want to show you how to navigate to it. So, and I'll do that in just a second. First, I'm going to go up to the topic center, and I'm going to select self-service. You may not have even realized that this was an option for you. So when we go to self-service, we're in the guides and resources part of that self-service. So then on this page, and I've blown this up a little bit to hopefully make it easier for you to see. I'm going to scroll down just a little bit. Up here at the top, we have some of our most often used items. And you see there's an article about natural language understanding and a link to the IVR operating guide. Again, I'm on the Part A side. If you're a Part B provider, you're going to want to, and I'll do this just for display here. So same page, but your Part B operating guide right here. So make sure you're in the right place, or some of your prompts are going to be different and it's going to become more confusing for you and the system. So let's just choose our natural language understanding here. So this is just a resource that we have that talks about what natural language is and how to use it and what would work best for you. So you can read a little bit more about that and see some examples of acceptable verbiage. I'm going to back up one screen, and this time I'm going to open the IVR operating guide. So you can see it's divided into sections. You know, it's broken down by topic or action, but you also then would have the option of downloading the whole thing if you wanted to. We talked about the conversion tools, so I'm going to go to the entering data section, and I'm going to scroll down. And so here you can see our converter tools. And remember I said the way that you enter an MBI is different from the way that you enter some of the other information in the IVR. So I'm going to just use my last name as an example, and mine is exactly 6 digits, and then the first initial of my first name. And so enter this number into the IVR. It's taken the letters of my name and told you exactly what to enter on your telephone keypad if you were going that route. I also mentioned how we have a chart. So down here we have this little chart or cheat sheet to show you how to use some of those common equivalents here. So I just wanted to show you that. Again, I recommend bookmarking this page and the actual page for the operating guide itself. Now I want to go back one more screen, and here I am back on the self-service guides and resources page, and I'm going to scroll down. I'll try not to do it too fast. I know sometimes that can wreak havoc with our eyes, kind of. And so we have a whole section here dedicated to the interactive voice response system. So there's a number of different ways to get to the same information. So again, I could look at that article for natural language, or I could open the operating guide. So just wanted to make sure that you knew that those were available. I'm going to go back to our slideshow now. And I have this screenshot in here in the event that for some reason our website was down or I was having technical difficulties. This screenshot here just kind of points out some of the places that we went. So if you wanted to refer back to this later, you would kind of refresh your memory on where we went. Now this is a list of those items that I just showed you. And then there's also a link to the CMS Internet-only manual system. And this is where you can read about the requirements for self-service technology, because it is required of all Macs to have self-service technology and specifically an interactive voice response system. So let's take a look at that real quick. This is the Beneficiary Provider Communications Manual, and specifically Chapter 6. Take just a second to switch over and open up here. And I want to go, I know that it is Section 50, so I'm going to scroll down to Section 50, PSS, Provider Self-Service Technology. So here are the requirements for self-service technology, why we have to refer you to those tools. And then specifically 50.1 is where CMS talks about the requirements for the interactive voice response. And so this is helpful information if you want the why. Why do we have this tool? Why do we require providers to use self-service? Those types of things. And so I just wanted to point that out to you, even though we didn't specifically talk about those requirements, where you can find them. If you downloaded a copy of the presentation, you have these links available for you so that you can jump to these different tools if and when you desire to. Now, this next item is a special announcement, and CMS did recently publish a change request. It's change request 13754. We have a link to it here. If you're listening live and you've downloaded the presentation from our website, you'll notice that this slide is not included. So I will ask Tom to add the link for this to the chat. Right now, you are still able to use the IVR to obtain beneficiary eligibility, but CMS is directing Macs to disable that eligibility information from their IVR systems, and they've given a deadline of March 31st of 2025. Since this is so new, WPS does not have a firm date for when that will occur yet. The reason for this is in CMS's ongoing commitment to protecting beneficiaries from Medicare fraud and also protecting the Medicare Trust Fund. This is part of that ongoing effort. The change request goes on to state that this is a pilot and it does include most Macs, and then CMS will monitor the impact of this change, and then they'll evaluate whether they're going to reinstate that eligibility information on the IVRs or if it's going to become permanently discontinued. This slide also lists the other self-service tools that providers have the option of using to check eligibility. So we have the Secure Net Access Portal. So that's the secure side of the WPS website. It recently was redesigned for better functionality and efficiency, so that's a good option for you. We do have some planned educational sessions about this very thing if you're interested in learning more about using the portal to check eligibility. Part A providers can use the direct data entry or DDE system to obtain eligibility. And then finally, the HIPAA eligibility transaction system or HETS. That can also be used and provide the beneficiary information that you need. So we wanted to make you aware of that, that is going to be something that is implemented sometime before March 31st, 2025. It will be communicated, so watch our e-news and our website for more information on that. I'm going to check in with Tom now and see if we have any questions placed in the chat related to today's topic that we can address. Tom, any questions?
Aline, we have not had any questions.
All right, I appreciate you checking that for me and monitoring the chat. When we're sharing the PowerPoint, we can't see that chat always, and so I'm appreciative of Tom there in the background doing that for us. So we're just going to move on here. Please take a few minutes to complete a survey about this course. You know, tell us what you liked, what we could do better. Give us suggestions for future education. Answer some questions for us. Would you recommend our training to other people? Do you plan to attend future events? Things like that. You do have a few options depending on your preference. You can use the link in the chat, or when you exit the webinar, when we're all done and you close out of WebEx, you'll be asked to go to an external site. And that external site is the CMX Qualtrics page for the survey. And that message will look similar to what you see here. We've included a sample here just so you can kind of get an idea. It has this triangle with the exclamation point. This verbiage, unfortunately, doesn't give a good explanation, and we aren't able to change that. But it is safe, and it is the CMS Qualtrics site for the survey. So if you click the blue continue button, it'll take you right to that survey so you can give us your feedback, and we hope you do that. If you're listening to the encore, you'll also see a box that's going to appear that links you to the survey. It'll look similar to this here with this hand and the stars. Or if you're listening to the encore, you can scroll down into the description of the video, and we have a link there for you also. Those surveys give us an insight into how we're doing and the type of education that you want and that you need. On behalf of myself, Tom, and all of us in Provider Outreach and Education, I want to thank you for your time and your participation today. We hope to have you join us for future events, and we look forward to your survey feedback. You may now disconnect.